Hi there, you're welcome to DamiRx Care channel where we talk about medications and how to use them properly. If you're new to our channel, make sure you hit the like and subscribe button in order to get alerts anytime we post any informative videos on our channel. All right, so what is our topic for today? So today we'll be talking about two medications that are used as pain relievers. So sometimes at work I get questions such as, "Hey, Abby, what is the difference between ibuprofen and Tylenol? Why should I use ibuprofen and not Tylenol? Why should I use Tylenol and not ibuprofen?" So this video is to kind of give you guys some insights on both medications and kind of how they both work and what to look out for when taking both of those medications. All right, so first we're going to talk about ibuprofen. So ibuprofen is also known as a brand name called Advil as well as Motrin. So whether you know it as Advil or Motrin, they both contain the same content, which is ibuprofen as the main ingredient. Okay. So how does ibuprofen work? So first we have something called prostaglandin, which is made in our body whenever there's an issue with any parts of our body. So let's say, for instance, you hit your elbow on the wall. So your body immediately start creating like prostaglandin in that area to kind of help your brain senses that, hey, there's something going on in this part of my body and I need to treat it. So the prostaglandin is kind of that chemical that creates that swelling and inflammation and kind of helps you realize what part of the body that you're trying to treat or what part of the body that you're having pain in. All right. So what ibuprofen does is it's a part of a class of medication known as NSAIDs, and NSAID is known as a non-steroidal anti-inflammatory drug. All right. So what it does is that it decreases that inflammation by blocking the enzymes that create that prostaglandin. So what it will do is decrease that swelling or that redness or the pain that the patient is feeling by blocking those enzymes that will create the prostaglandin that are causing that inflammation or swelling in that area of our body. So ibuprofen comes in tablets, it comes in an injection, it comes in a solution as well. And the over-the-counter one is usually a 200 milligram. And as a prescription, you can get, I believe, the 400, 600, and the 800 milligram. So all in all, you don't want to take more than 3,200 milligram in a 24-hour period. So let's say, for instance, you're taking an 800 milligram. So your doctor would not want you to take at least maybe 4 of that 800 milligram, because like I said, you're not supposed to pass that 3,200 milligram in a day. So you would take the 800 milligram. It's usually popularly used as every 8 hours. Some patients will have to take it every 6 hours to help control whatever pain they're feeling. But like I said, the maximum dose that we want you to be taking is not more than 3,200 milligram in a 24-hour period. All right. So what is ibuprofen used for? So ibuprofen can be used to treat fever, pain, headache, muscle cramps, migraine, arthritis pain, painful menstrual cramps, like I said earlier. And those ibuprofen work best in like treating like muscle pain or like pain in like certain organs of the body, to kind of help reduce, like I said, that prostaglandin, to help reduce that pain and swelling that patient is feeling at that period. All right, so what are some of the things to expect while taking ibuprofen? So what are the side effects? So ibuprofen has a big side effect profile. So that's most likely why we will tend towards Tylenol compared to ibuprofen. Because like I said, it works in those organs more often compared to Tylenol. Tylenol works more in the brain. All right. So we have side effects such as rash, heartburn. So it can kind of cause some stomach upset here and there. So we wouldn't really recommend it in patients that have like a stomach disease or like a stomach condition that can kind of that ibuprofen can kind of precipitate like a condition in those patients. All right. So it can cause nausea as well as gas, dizziness, and headache as well, which is pretty ironic. You know, you would think it helps treat headache, but it can also cause headache probably if you take it too much. And these are just common side effects that patients have reported. And you have to understand that usually with side effect, it might not necessarily be the medication that's causing them. It might be some patients have other conditions that, you know, they would report it as a side effect just because they're feeling it after taking that ibuprofen. All right, so what are some serious side effects and what makes ibuprofen less preferable compared to Tylenol? So ibuprofen can kind of worsen heart conditions such as like cardiac arrest, hypertension. So like I said, it can kind of worsen that condition. So we usually don't want to take ibuprofen if you're a patient with hypertension or patients who have like a heart failure, because it can kind of increase that fluid retention in those patients which we don't want. All right, it can cause stomach bleeding. Like I said, it kind of is more acidic, so it kind of helps increase that stomach upset that patients may feel when they take some acidic food. It increases heartburn, like I said earlier, because of the acidic profile of the medication. All right, and also in patients that have kidney disease, this is a no-go area. Ibuprofen can worsen any kidney injury or kidney failure in these patients, so we wouldn't use ibuprofen. So we would tend to use more Tylenol or a medication that does not worsen that condition in those patients. All right, and how do you want to take ibuprofen? So ibuprofen, you most likely want to take 1 tablet if you're taking the 800 or higher dosage. For patients who are on the 200 milligram over the counter, you can take 2, but like I said, making sure you're not taking more than that 3,200 milligram in a day. So you probably want to start with 2 tablets, and you want to make sure you take ibuprofen with food to kind of reduce that stomach upset that I said earlier, and kind of help reduce any heartburn or nausea feeling that you may get after taking ibuprofen. So it's preferably taken with food or milk, all right, to kind of avoid that stomach upset like I mentioned earlier. Also, like I said, ibuprofen should be avoided in patients who have like a cardiovascular issue, which would be like your hypertension, cardiac arrest, heart failure, heart attack. So like I said, we would tend towards Tylenol. So back to Tylenol. So Tylenol, it's generic. It's also known as acetaminophen. In some other countries, Tylenol can come in form of Panadol or paracetamol. I know in UK, they call it paracetamol rather than Tylenol. So all the same, they all contain acetaminophen. So how does acetaminophen work? So it really doesn't have a direct mode of action, but it is proposed that Tylenol can help reduce the production of prostaglandins, which are the chemicals that causes that inflammation and swelling, and it can help reduce those chemicals in the brain, and it kind of help reduce how the patient is percepting that feeling and kind of reduce that pain symptoms the patient is getting from Tylenol. So Tylenol comes in an oral tablet as well as a solution or an injection. It comes in different strengths. So it comes in like a 325 milligram, which is the regular strength. The extra strength is the 500 milligram, and I believe the 8-hour strength is the one that is the 650 milligram. So usually you kind of tend towards which one. Most likely patients will take the extra strength depending on how much pain they're feeling. So I usually see more patients being on the 500 milligram, which is the extra strength. All right, so with Tylenol, what is the maximum amount that you can take in a day? So the maximum is 4,000 milligram in a 24-hour period. So we don't want to take Tylenol for more than that 4,000 milligram, because what it's going to do is it can cause an acute liver injury. So just like ibuprofen work more in the kidneys, or it gets filtered more in the kidneys, the Tylenol get filtered more in the liver area. So it gets metabolized in the liver, and you kind of want to make sure that you're taking the right amount just so you don't hurt your liver, okay? All right, so like I said, maximum dose for Tylenol is 4,000 milligrams. So if you're taking the 500 milligram, you don't want to take more than 8 capsules a day. If you're taking the 325 milligram, make sure you're not exceeding that 4,000 milligram in a 24-hour period, which is a day. All right, so what is Tylenol mostly used for? So it's used for fever, pain, and mostly patients will use it for migraine as well. So Tylenol, when it comes to side effect, has like a lower side effect profile, which will be like your nausea, vomiting, headache. It can cause insomnia as well. So some patients have noticed they weren't able to sleep well after taking Tylenol, as well as constipation. So just like I said, with side effect, it doesn't happen to everyone. Just in case if it does, you can kind of notice how your body is feeling after taking the drug and kind of determine if this is due to the medication or your body is not handling it as it's supposed to. All right, so what are some serious side effects of Tylenol? So compared to ibuprofen, where we have the cardiac arrest that it can worsen, or hypertension that it can worsen, with Tylenol, it's more of the serious side effect, or more of if you have like a liver injury, or if you're an alcoholic, you most likely don't want to take Tylenol because you're already having some liver issues in those kind of patients that are more prone to drinking alcohol, because like I said, alcohol is metabolized in the liver as well. So you don't want to take Tylenol on top of alcohol, because then you're hurting your liver. So usually in patients, when it comes to the serious adverse effect, it will be patients who have like a serious allergic reaction to Tylenol, like a Stevens-Johnson syndrome, which is like a condition where your body is actually burning. If you get this burning feeling on your skin, like I said, that's like a severe allergic reaction. Also, patient can get TENS, which is like a toxic epidermal necrosis. I'm trying out big words here, but these are like severe allergic reaction that patients may get to Tylenol. It doesn't happen to everyone. Also, when it comes to Tylenol, we don't have to make use of that reservation where we want to take like food or milk, as opposed, like ibuprofen. So with Tylenol, we can just drink a cup of water and take it on an empty stomach, because it doesn't affect the stomach as much as ibuprofen. All right, and when it comes to Tylenol, like I said earlier, you don't want to take it in patients that are alcoholic, because those patients probably have some liver injury going on already. So we don't want to take Tylenol in those patients, just to not increase their risk of getting like a liver failure or something like that. All right, so I hope this video was helpful in terms of comparing ibuprofen and Tylenol to kind of see which medication would be more preferable for you as a patient. Like I said earlier, with ibuprofen, we tend to frown on it in patients who have like heart diseases or heart conditions like hypertension, cardiac arrest, heart attack, stroke. In those kind of patients, we wouldn't take ibuprofen because it can worsen those conditions. With Tylenol, in those patients, you're fine. So you can take a Tylenol. When it comes to the liver injury or patients who have a liver failure or a history of a liver disease, we wouldn't take Tylenol in those patients because it can increase or worsen that condition. So ibuprofen is a no-no for heart condition and kidney condition, while Tylenol is a no-no in patients who have liver disease. All right, so I hope this kind of boils it down for you. Thank you for watching. Make sure you hit your like and subscribe button if you did enjoy this video, and we look forward to seeing more of you in other videos. Thank you, and stay tuned.